Now let's talk about gonorrhea. This is a sexually transmitted infection, popularly called STIs. It can affect both a man and a woman. So do not think when you hear gonorrhea is only for a man. No, it affects both a man and a woman. Now, how is this contacted? It can be contacted in 3 ways. Either through VJ intercourse, or anal intercourse, or oral. Do you understand? So for those of you who go through the anus to have intercourse, that can be gotten through that means. For those who go through the normal route or the normal mode of entry, which is the VJ, gonorrhea can be contacted through that means. For people who during foreplay actually uses their tongue to, go do oral sex, it can actually lead to gonorrhea. Now let's talk about the places that gonorrhea can affect when it actually enters the person's body. Now, if it enters a man's body, let's talk about the pen now. If it enters a man's body, there are 2 main places it can affect. Number 1, the urethra. Now, the urethra is the tube that actually connects from the bladder to the exterior, like where the urine is carried from to the penis, where you can actually see pee coming out. That's the urethra, okay? That tiny tube that carries urine from the bladder to the outside world. For a man, you discover that the same passage where urine comes out from, that is the same passage where sperm or semen comes out from. So they have one common passage for both urine and semen for the men. So if gonorrhea enters, it majorly will affect that tube called the urethra, since that is the only passage where both semen and urine comes out from. Do you understand? Now, the next place it can affect in a man is the throat. That is for those who actually do oral sex. You actually do during foreplay, you take care of your woman very well, you lick everywhere. If the woman has this infection called gonorrhea, the man can actually take it in through his mouth, and it's definitely going to affect his throat. What will happen? The signs and symptoms for a man when it affects him, if the infection is through oral sex, it goes to the throat, it's going to cause sore throat. How many of you have discovered that maybe after oral sex, the next day you begin to discover that there's this discomfort around your throat? If you swallow saliva, it feels like it's painful, it's hurting. The next thing is very painful, you can't even swallow. Okay? So it majorly affects the throat if it's through oral sex and the woman had this infection. It's going to cause sore throats. If it was through VJ intercourse or anal, it's definitely going to affect the urethra of the man, since it shares one common passage for both urine and sperm. Now let's talk about the places it affects for a lady. Number 1, the VJ. Number 2, the cervix. It goes up. When you put your hand as a woman into your VJ, the next place you meet feels like the bridge of the nose. That's called the cervix. So gonorrhea will affect the cervix, and from there it will spread into your reproductive system. It will go to the fallopian tube, it will go to the ovaries, it will go to the womb or the uterus. So for the lady, it can affect a lot of places, and also the throat. So if the man has gonorrhea and the lady does, suck the man, maybe, sucks the penis or gives a blowjob, and a man has gonorrhea, it can actually affect the throat of the lady as well, causing sore throats. Now, what are the signs and symptoms of this infection called gonorrhea? Number 1, for both the male and the female, the first thing you start noticing is pain during urination. So you want to have a wee, you want to go for a pee, and then the next thing is a peppery feeling. You're peeing and there's that peppery sensation around the urethra. That's because this infection on its own irritates the urethra. That's the passage through which urine comes out from. That's you, both for a man and a woman. A woman has urethra that brings urine out of her body. A man has urethra that also brings urine out of his body. So when there is gonorrhea in both a man and a woman, the first thing is a burning sensation. That's peppery feeling when you're peeing. Number 2 is pain during intercourse. For a woman, you may start observing that there is this pain around your VJ during intercourse. Number 3 is abnormal discharge, both for the female and the male. Normally, a man should not have any discharge at all from his penis, unless during intercourse where he's ejaculating semen. Okay? You should not just stay and start seeing some discharge coming out of the head of the opening of your penis. That's abnormal. So, but if a man has gonorrhea, this will happen. He will start discovering that there are some certain discharges. It can be greenish, it can be milkish, it can be yellowish, just a discoloration generally. You start noticing fluid coming out of your penis. You start noticing some irritation, maybe itching, rashes around it, and you're just feeling uncomfortable. Pain when you're peeing. Even during ejaculation, when you're releasing, you feel that pain. For a woman as well, abnormal VJ discharges. This is not the same as your ovulation discharge or the discharges that should happen during your menstrual cycle. No, you will notice that the color would be different. How can you see a greenish or brownish discharge? It is abnormal. It has an abnormal color. Even the smell is abnormal. The odor. You will start experiencing itching around your, genital region. That's a sign. How do you know if you've got gonorrhea? What kind of test can I do? One, urine culture. So urine sample can be taken from the man or from the woman and cultured. Okay? The gonorrhea, the bacteria can be detected in the urine when it's cultured. Now, the name of the bacteria that causes gonorrhea is called Neisseria gonorrhea. Neisseria gonorrhea. Another test that can be done is a swab test, whereby a sample is taken from the throat as a throat swab, or from the cervix if it's a woman, from the urethra if it's a man. This swab is taken and then cultured as well to detect this bacteria. Now, what can I do if I actually detect or I know someone who has gonorrhea? Number one, antibiotic medication. So antibiotic is prescribed for this person, and you must actually take it for the period of time it was meant to be taken. You take this antibiotic it can be for a period of 7 days, 3 times a day for 7 days. Number two, for the period you're taking this antibiotic, you're going to abstain from anything intercourse, both oral sex, anal, or vaginal sex. You're going to abstain from it until you're done with this medication. Number three, you have to inform your partner. So if it's a man that is actually discovered that he has gonorrhea, he will not have intercourse with his wife or with his sexual partner for that period of time, and he has to let the partner know so that that person can also be on antibiotics as well, so that both of them can treat themselves at the same time to avoid reinfection